Hello everyone, this is Dr. Joe Ranney from Healing Frontiers, and today let's talk about chiropractic treatment for back pain. So normal everyday activities can make an enormous impact on your body, especially when it comes to your spine. Ordinary back issues are fairly, ordinary. About 80% of people will endure back pain in their lifetime, and most of the time it's caused by misalignments. These misalignments set your body up for restricted movement of the joints in your spine. The biggest issue with back pain, though, isn't the actual pain itself, it's ignoring the pain like there's nothing wrong. That's a huge mistake. Sure, back pain is fairly common, but ignoring it entirely is the wrong move. Pretending you're fine and foregoing a trip to the chiropractor probably seems okay at first, but downplaying pain and pretending it isn't there can lead to more serious, even permanent problems. The easiest way to check in on your back pain is to keep a checklist in your head of dangerous symptoms that could possibly go hand in hand with it. Ask yourself, do I have any of these in addition to my back pain? If you do, you could have serious problems on your hand. Radiating pain into your leg is a huge one to look out for. If you've got painful waves of pain that radiate from your back down to your legs and even into your feet, then you could have nerve root irritation issues going on in your spine. It might go away, but it also might lead to tingling, weakness, or numbness, and eventually even to muscular atrophy in your leg. Your best bet is to talk to a chiropractor who can help make the right spinal adjustments and also offer recommendations for exercise that can help to remedy your issues. Leg weakness is a big one to watch out for. Also, do you find yourself limping? That could be a back issue that's stemming from nerve damage. And you know what? It could possibly become permanent if you leave it alone long enough. It's possible you're even dealing with something called a herniated disc. Severe low back pain and leg pain accompanied by numbness or pain around the rectum and loss of bowel or bladder control is a medical emergency. If this happens, get help immediately. This could possibly be a condition called cauda equina syndrome, where pressure is being applied to your nerves in your spinal cord that connect to your pelvic organs. This, as I said, is a medical emergency, often requiring immediate surgery. Another thing to look for is falling over, imbalance, or teetering on your feet are additional effects of back pain as well. If you leave these alone too long, you could be stuck with permanent loss of equilibrium and balance. You can even develop fever or chills from back pain. While most back pain doesn't mean you have a tumor or some kind of infection in your body, this could always be a possibility. You definitely want to get your back checked out immediately if a fever or chills are accompanying symptoms. New York's University Langone Spine Center, Dr. Charla Fisher says that if you do experience chills or a fever, that's often a sign that your whole body is going through a reaction to something else. In other words, get this checked out immediately. Reading up or listening to back pain information and getting advice on your back pain is a great start. But if you're having regular spinal or back pain problems, you need to see a professional right away. That's where chiropractic care comes into play. One of the greatest advantages of chiropractic care is that attention is directed to the cause of the symptoms rather than just giving a quick fix to get rid of painful symptoms. Simply covering up the problem won't help you avoid permanent damage or even give you a viable fix for the issue. Chiropractic treatment is non-invasive. The American Chiropractic Association shows research that provides information on how spinal manipulation for back and neck pain or injury isn't nearly as costly as pharmaceutical treatment. Still, some people don't choose to see chiropractors. Consider this for a second. A Washington study showed that about 42.7% of patients who suffered from a work-related back injury ended up in surgery. That's when they consulted a surgeon first. But only about 1.5% of people ended up in surgery when they consulted a chiropractor first. That's amazing. So even though back pain is common, keep in mind that not every treatment option is equal. Consider looking into chiropractic care for an all-natural and effective way to treat back or neck pain. Thanks for watching. Please like and share this video and also post any comments or questions below. And I hope you enjoyed it.